medicine. He had some sedation medicine that he received, and then we just gave him a shot to have him go to sleep. And so he's somewhat anesthetized and he's on his way down. We have to always guess, of course, how long it's going to take, and each animal's kind of unique. He could have immediately went down with that pre-medication we gave him, or it could take another 5 minutes, but you can see he's starting to really lose control. And so once he's asleep, we'll pull him out. We're going to get him up on the table and start our procedures to definitely do the medical exam through his entire body as far as that goes, but we do know about his teeth already, which are in really bad shape. So at this point it's definitely worth doing the sedation for him, and we always want to make sure that we don't do it unless we need to, because there are risks involved, and the last thing we'd want to do is rescue an animal and have any problems from the sedation. So we're going to give him another minute or so to actually go completely asleep so that we can actually pick him up and bring him over to the exam table. But in the few seconds that we're waiting for this to happen, I'll show you the sanctuary's veterinary hospital. This is the treatment room and exam room. This is a wet table where it has a hydraulic or winch system that can pick up upward to 2,000-pound animals, since we do have Kodiak grizzly bears here at the sanctuary that weigh almost 2,000 pounds. And then we have a surgery suite next door that we do all of our main surgeries with. But right now these are the recovery pens, and so I think we're getting close. He's still licking his lips, but the team here will go in and get him in a gurney here in a second and bring him over, and then we'll start the procedures. But this morning the team from the Peter Emily Dentistry Foundation will be coming as well, and they'll be the ones that will do the root canals on his 2 teeth, his canines that have really bad roots that are rotted out at this point because his teeth were broken off, and that's a very painful situation for anybody, people or animal. So I think we're pretty close. I think you could open the door, Casey, and check it, or Becca, whatever, and give him a check. He's not quite under as far as that goes, but he's not going to be able to move much. I think we can go ahead and lay him out. So they're going to be real gentle with him, get him onto a soft gurney, and bring him out to go ahead and get him onto the exam table. So we rescued quite a few animals recently in December, and unfortunately we can't really talk a lot about this case. It's a court case that's still pending, so it's right now sensitive information that can't really be released to the public, and so we're not at liberty to tell you exactly where he came from, but he was one of many animals that we rescued in December of 2017, and so they will be receiving medical care for any of the ones that we definitely know have issues. And then the thing that we normally do is get them in here and let them get situated in the sanctuary where they get used to the sights and the sounds and the feeding schedules and their new enclosures that they're in. And basically at that point, by then we'll start to notice things that are apparent with the animals, if they have any kind of subtle issues that we weren't really aware of right away. So they're getting him set up sternal, getting ready to intubate him, which is for the gas machine that will help give him the gas that will keep him down, and he'll be able to be under while we do all the procedures. So right now they're going to open his mouth and they'll go ahead and intubate him, which is pretty normal for any kind of procedures that are going to take a while and not be able to do just through the general sedatives that we give them. And so Val is our veterinarian here today, and Becca is the one putting in the intubation tube, and so they got it in nice and successfully. I'll get it ready to get the machine on it, and then we'll be able to start doing his medical exam. So the Wild Animal Sanctuary is located outside of Denver, Colorado. We're a 720-acre facility that has nearly 500 rescued lions, tigers, bears, wolves, leopards, mountain lions, large carnivores like that were rescued from either illegal or abusive situations and from places that closed down. And so we have all these animals we bring here, but rather than keep them in small traditional cages, they get to live in large acreage habitats. So most of our habitats range anywhere from 5 to 25 acres. And so this tiger specifically will be able to live in a large acreage habitat with some of the other ones that he came here with and has already known from the place they came from. And at that point, he'll live the rest of his life roaming freely in that habitat and being fed very well and have a very comfortable, safe life. And so you can imagine what it'd be like to have 2 broken teeth that have very painful root problems that would kind of negate all that nice change in your life to have a nice, happy life. And so we're going to fix those today. At the same time, they're going to do a lot of normal procedures like checking his paws and his teeth and other teeth and doing an ultrasound on his abdomen and many of the things that we would do just to make sure there's no hidden problems. And so currently they're just finishing setting him up and trying to decide which way to lay him out now that he's intubated. I'm going to rotate him over. And so he's a 17-year-old male tiger, and actually that's not too old. They'll live all the way up to 23 years in age, and so he's not exactly a youthful tiger, but he's not an old tiger yet. And so he's got many more years that he could live here and be happy and be able to roam freely. Unfortunately, he's declawed, and that's one of the things that we're going to look at today. Is somebody chose to take his claws out, and probably when he was a cub, and so that creates all sorts of problems for them as an adult because it changes their gait and all sorts of things that can have long-term effects like arthritis, and many times they don't get the root of the nail bit out when they declaw them, and so sometimes they'll have their claws try to grow back, or pieces of the claws try to grow back, and it's a very painful situation. And so we'll be doing x-rays on his paws today. We work with Dr. Jennifer Conrad, who does the Paw Project, and he needs special attention with his paws where she can come and do a surgery to rectify any issues, and we will. But right now we don't know without doing the x-rays what exactly the problems are. So in general, now that he's sedated and intubated and breathing through the machine and staying nice and comfortable, they're starting all the normal procedures where they look at his abdomen and paws. Right now they're going to go ahead and draw some blood and get some blood work done on him as well, so that we can make sure that his kidneys and liver functions are well and doing good. And then we will obviously give him some antibiotics and some vitamin injections to help him as well, and do some IV fluids. So right now they're just getting ready to draw some blood on him. I'm going to go around here where you can see him a little bit closer. So he's a beautiful male tiger. He's sleeping right now. He's actually not asleep. The drugs. He is awake, but he can't move and can't feel anything that we're doing. So he's just laying here and kind of comfortable. And we're monitoring devices on his tongue to make sure his heart rate is doing well and that he's breathing well. And but you can see, that basically this is a tiger claw paw, and he doesn't have any claws in there. Normally if I pinch this, you would see his claws come out. So those have been taken out of his paws when he was young, and depending on how they did it, a lot of times they'll cut off a portion of his digit, and so that shortens their paw and makes it more difficult for them to have a correct stance when they're walking or running. And then he obviously has issues with his teeth. You can see that was broken off. And the bottom one is not much better. He's got tartar, obviously. So those are big issues as well. And so, again, Peter Emily Foundation will be showing up any minute to start that procedure. But the team here, the sanctuary's been in operation starting this month is 38 years that we've been in operation. We are open to the public. And we do allow people to visit, but it's on an elevated walkway, which doesn't put any pressure on the animals, and so it goes over their natural habitats where they can still roam freely and not have all that pressure from people being down at ground level and bothering them. And so when people do visit, you'll walk on a 1.5 mile walkway that goes over all the habitats and be able to see these animals living freely in their open habitats. And so this is just one of a number of animals last month that we did rescue, a number of tigers and bears and other animals. So currently, like I said, we have nearly 500 animals here right now, and we are adding more acreage all the time. So right now we're at 720 acres, and we just signed another deal for more acreage to be added this year. And so it'll be somewhere from a few hundred acres all the way up to maybe 700 more acres this year, so that we can create more habitats and be able to help more animals that need our help. Currently in the United States, there's thousands of lions and tigers and bears that are outside the zoo system in either roadside zoos or backyards or basements or apartments, and many of them are like this, where they've been declawed. Somebody tried to have them as a pet or play with them when they were young and take photos with them, and so all those things are pretty bad repercussions for the tiger throughout the rest of their life, because they tend to be used just when they're cubs and when they're very little, and then after that, that's when they become worthless to all these people that were trying to capitalize on their cuteness and the attraction of it. And then most of them usually either end up dying somewhere or whatever because they don't have a place to go. But our sanctuary and other sanctuaries around the country rescue animals like this and give them a permanent home for that very reason. And so, he's got a lot of procedures to be done today. We could go on for quite a while, but I don't think we can go on forever. We do appreciate the Dodo's impact page allowing us to bring this to you so you can get a close look at this tiger and see the kind of work that we do to restore them back to their normal health and as best we can, and be able to provide them a life of freedom and good care. So he'll live here until he grows old and dies of natural causes, as are the rest of the animals that live here. So we do want to thank you guys for joining us today. We're going to go ahead and sign off here in a few minutes. But anyway, we really appreciate everybody's support. If you want to learn more about the sanctuary, go to wildanimalsanctuary.org. Again, Wild